Top 5 nighttime signs diabetics must never ignore. Nighttime is supposed to be a time for your body to rest and recover. But for many people living with diabetes, the hours after sunset can quietly reveal signs that something deeper is going wrong. These aren't always loud or dramatic symptoms. Often they're subtle, even easy to brush off. But ignoring them could mean missing the early warnings of worsening blood sugar control or serious diabetic complications. Have you ever woken up drenched in sweat for no clear reason? Struggled with constant thirst that keeps dragging you out of bed? Or maybe you find yourself tossing and turning all night, with your legs tingling or cramping until morning. These may seem like small annoyances, but for someone with diabetes, they can be signs your body is trying to warn you. At night, when you're not eating or active, your blood sugar levels can swing unpredictably. For some, they crash dangerously low. For others, they rise silently to harmful levels. Your body reacts, but it does so in ways many people don't recognize. In this video, we'll explore the top 5 nighttime signs diabetics must never ignore. These are the clues your body gives you while you sleep, or try to, that could be pointing to insulin issues, nerve damage, or dangerous sugar imbalances. Understanding these signs early can help you take the right steps before things get worse. So, here's a question for you. Do you really know what your body is telling you at night? Or have you been missing the warnings all along? Watch closely, because these 5 signs could protect your sleep, your health, and maybe even your life. Night sweats, when your body is warning you. Waking up in the middle of the night drenched in sweat, even though your room is cool and you haven't had a bad dream, can be alarming. For diabetics, night sweats are not just uncomfortable, they're a serious warning sign. This common but overlooked symptom often points to nocturnal hypoglycemia or low blood sugar during sleep. Your blood sugar naturally drops while you sleep because you're not eating, but in diabetics, especially those taking insulin or certain oral medications, it can drop too low. When this happens, your body goes into alarm mode. It releases stress hormones like adrenaline and cortisol to try to raise your glucose levels back up. This hormonal surge is what causes intense sweating, rapid heartbeat, and sometimes anxiety or even nightmares. If you're consistently waking up with cold, clammy skin, soaked bed sheets, or a racing heart, it's your body trying to tell you that your blood sugar is falling dangerously low. And here's the danger. You might not remember it happening. Hypoglycemia during sleep can sometimes go unnoticed until it becomes severe. And severe nighttime lows can lead to confusion, unconsciousness. Night sweats can also disrupt your sleep, leaving you exhausted the next day, making it harder to manage your diabetes. Poor sleep raises stress hormones, increases insulin resistance, and can trigger unhealthy cravings for carbs and sugar. If you notice night sweats, check your blood sugar before bed to make sure it's not too low. Avoid alcohol in the evening. It can lower glucose levels overnight. Talk to your doctor about adjusting your medication timing or dosage. Keep a small snack near your bed if your sugar tends to dip. Don't ignore this sign. It's your body fighting to keep you safe. Night sweats aren't just about comfort, they're about control. If your body is sweating out a warning, it's time to listen. Frequent nighttime urination, a silent sugar spike. Waking up once in a while to use the bathroom may not seem unusual, but when it becomes a pattern, 2, 3, or even more times each night, it could be your body's way of telling you something's wrong. For diabetics, frequent nighttime urination, also known as nocturia, is often a signal of high blood sugar levels that are quietly rising while you sleep. Here's why it happens. When your blood sugar gets too high, your kidneys work overtime to filter and remove the excess glucose from your blood. They pull water from your tissues to do this, which fills your bladder more quickly. The result? You're constantly running to the bathroom, interrupting your rest and stressing your system. This cycle can be exhausting. You're not only losing sleep, you're losing hydration, which can lead to dry mouth, headaches, and even further blood sugar imbalance. Worse, many diabetics don't realize their evening meals, medications, or lack of activity are contributing to this nighttime glucose surge. It's not just annoying, it's risky. Chronic nocturia has been linked to worsened blood sugar control, higher risk of kidney damage, increased blood pressure, daytime fatigue, and mood issues. If you're diabetic and waking up more than once a night to urinate, don't ignore it. Instead, take action. Track your blood sugar levels at bedtime and early morning to spot trends. Avoid heavy carb meals or sugary snacks late in the day. Drink most of your fluids earlier, and limit fluid intake 2 hours before bed. Consider talking to your doctor about adjusting medications or insulin timing. It's easy to blame nighttime bathroom trips on aging or a sensitive bladder, but if you're diabetic, this could be a key sign that your nighttime blood sugar isn't under control. Your sleep is valuable, and so is your kidney health. Pay attention to this sign before it becomes a deeper problem. Restless legs or tingling, a warning from your nerves. Do you ever feel a strange crawling sensation in your legs when you're trying to fall asleep? Or maybe your feet start tingling, burning, or feel numb at night. For many diabetics, these uncomfortable sensations are more than just annoying. They could be early signs of diabetic neuropathy or nerve damage caused by high blood sugar. Your nerves are incredibly sensitive to changes in blood sugar. When glucose remains elevated for long periods, it starts to damage the small blood vessels that supply oxygen and nutrients to your nerves. The result is a gradual loss of nerve function, especially in the legs, feet, and hands. This can show up at night as restless legs that twitch, jerk, or feel an overwhelming need to move, burning, tingling, or electric shock sensations in your feet, numbness, or a dead feeling that worsens while lying down, aches, or sharp pains that seem to appear without reason. Why at night? During the day, you're often distracted or moving, which masks mild symptoms. But when you're still and quiet at night, these nerve signals become more noticeable and much harder to ignore. Diabetic nerve damage doesn't happen overnight. It creeps in slowly, and if you ignore it, it can progress into permanent numbness, ulcers, infections, and in severe cases, amputation. That's why it's critical to recognize these early nighttime signs. If you're experiencing these symptoms, check your blood sugar regularly, especially after dinner and before bed. Improve your circulation with gentle leg stretches or a warm bath before bed. Avoid alcohol and smoking, which worsen nerve damage. Talk to your doctor about neuropathy screening and protective supplements like alpha-lipoic acid or B vitamins. Your body is speaking, even in the quiet hours of the night. Don't ignore the message. Waking up thirsty or with a dry mouth, the dehydration signal. Waking up with a parched mouth, dry throat, or an overwhelming thirst is more than just inconvenient. It's one of the clearest signals that your blood sugar may be running too high during the night. For diabetics, this isn't just about needing a glass of water. It's a warning sign that your body is struggling to manage glucose levels. High blood sugar pulls fluids from your tissues. Your kidneys respond by trying to flush the excess sugar out through urine, which in turn dehydrates the body. That's why you may wake up feeling extremely thirsty, even if you drank water before bed. And because this fluid loss often happens quietly while you sleep, you may not even realize how much water your body is losing. Symptoms to watch for include sticky or dry feeling in your mouth and throat, cracked lips or a dry tongue upon waking, frequent urge to drink water at night, a slight headache or dizziness in the morning. While a dry room or mouth breathing can contribute, for diabetics, this is often a sign of overnight hyperglycemia. Left unaddressed, it can impact your sleep quality, energy levels, and long-term hydration status. Here's what you can do. Monitor your blood sugar before bed and first thing in the morning to catch spikes. Limit sugary, salty, or starchy foods in the evening, as they can trigger glucose surges. Use a humidifier if your bedroom air is dry, but don't assume it's the only cause. Talk to your doctor about adjusting your evening insulin or medication schedule. Remember, your body craves balance. When it keeps asking for water at night, It may be desperately trying to correct something bigger, excess sugar in the bloodstream. Don't ignore this thirst. Hydration is vital, but so is the reason your body is so thirsty in the first place. Insomnia, when blood sugar disrupts your sleep. If you find yourself staring at the ceiling night after night, unable to fall asleep, or waking up frequently, feeling restless and alert, your sleep issues might not just be from stress or bad habits. For people with diabetes, insomnia can be a direct result of blood sugar imbalance. Blood sugar plays a major role in regulating your sleep cycle. When your levels are too high, hyperglycemia, or too low, hypoglycemia, during the night, your body becomes unsettled. High blood sugar can cause frequent urination, dehydration, and overheating, all of which disturb sleep. On the other hand, a sudden drop in blood sugar can trigger a stress hormone response, leading to sudden wakefulness, anxiety, or even night sweats. Signs that your insomnia may be linked to diabetes include difficulty falling asleep despite feeling tired, waking up at 2 or 3 a.m. for no reason, night sweats, anxiety, or hunger during the night, daytime fatigue despite spending 7 to 8 hours in bed. This kind of insomnia doesn't just make you tired, it raises your blood sugar the next day, creates a cycle of stress and poor glucose control, and increases your risk of long-term complications. Lack of sleep worsens insulin resistance, increases cravings for sugary foods, and raises blood pressure. To improve sleep quality as a diabetic, keep blood sugar stable before bed. Avoid late-night snacks high in carbs. Try relaxing routines like stretching, reading, or a warm shower to lower stress hormones. Avoid caffeine or alcohol in the evening. Both can spike or crash glucose. Monitor your nighttime glucose patterns with a continuous glucose monitor, CGM, or morning blood sugar checks. Sleep is not a luxury, it's a vital part of your diabetic care. If you're constantly battling sleepless nights, your blood sugar may be the hidden cause. Don't just treat the symptom. Waking up at night, feeling very hungry. Waking up in the middle of the night feeling very hungry may look like a small thing, but for people with diabetes, it can be a warning sign that your blood sugar is too low while you're sleeping. This is called nighttime low blood sugar or nocturnal hypoglycemia. When your blood sugar drops too much at night, your body and brain don't get enough energy. So your brain sends a strong message, eat now! You might wake up suddenly, feeling shaky, weak, or confused. You may feel a strong need to eat something, usually sweet or full of carbs. Many people ignore this and think it's because they didn't eat enough dinner. But if this happens again and again, it can mean your medicine is too strong or your dinner didn't have the right balance of food. Some people eat a lot at night when this happens, which causes high blood sugar in the morning, and the cycle repeats. If you often wake up feeling very hungry, it's important to check your sugar levels at night, around 2 or 3 a.m., and talk to your doctor. You may need to adjust your dinner, snack, or medicine. Don't ignore nighttime hunger. It's not just your stomach asking for food. It could be your blood sugar asking for help. Your body doesn't stop managing diabetes just because the sun goes down. In fact, nighttime is when some of the most important and most dangerous signals quietly appear. The signs we've covered, night sweats, frequent urination, tingling or restless legs, extreme thirst, and insomnia, are more than just sleep disturbances. They are serious warnings that your blood sugar may be out of balance. Many diabetics overlook these clues, blaming stress, age, or poor sleep habits. But ignoring them can allow hidden problems like nerve damage, kidney strain, or severe sugar crashes to grow worse. Your body is speaking to you in the silence of the night. It's asking for help, and the sooner you respond, the better your chance of avoiding long-term complications. So ask yourself honestly, have you been noticing these signs and brushing them off as normal? Or are you ready to take control before things get worse? Start by tracking your nighttime symptoms. Check your blood sugar at bedtime and in the morning. Make small, consistent changes, adjusting your meals, your medications, and your sleep routine. And most importantly, speak with your healthcare provider if these signs keep showing up. Don't let your nights become a blind spot in your diabetes care. If this video helped you understand what your body might be trying to say, please give it a like and share it with someone you care about who may be ignoring these critical signs. You never know, one small piece of information could save someone from a big problem. Stay aware, sleep smart, and let your nights work for your healing.